We're really excited to be bringing together 150 people from the 4M Consortium to this conference today. The 4M Consortium is a group of researchers and non-researchers that are working at the intersection of menstrual and mental health. And our vision is a world in which menstrual experiences, including those around the first menstrual period, so menarche, and the last menstrual period, so menopause, don't negatively affect mental health and social well-being.
The conference so far has been absolutely wonderful. My organisation is based down in Cornwall. Often I'm sitting at my desk at home, working away. So just a huge sense of connection with others working in this field, and moving forward, I think collaborations, throughout the rest of my career.
I think attending the conference will really help my work and research further in a number of ways, one of which is to be more aware of the different circumstances that women have in different geographical locations, in particular what they can do for themselves and support their own health through self-care, and also being really clear that our research is answering important questions for those who are affected.
I think what I really loved was the different disciplines, the diversity of folks, but also the way in which the audience engaged and asked such interesting questions. Sometimes you kind of present and there's this awkward silence, but it felt like everyone was quite keen to engage everybody, and it was a very inclusive and safe space. I thought people were so comfortable that they were able to even share their own lived experiences. There were some very touching insights.
I think attending the event will be really helpful for my research in a few different ways. First, I've met several other researchers who are doing sort of similar things, so it'll be really nice to link up with them. So for example, most of my research is about ADHD, and I've talked to some researchers who focus on people with autism, so it's been really interesting to see kind of the commonalities with that kind of research. Additionally, it's been really nice to hear from the GPs who are here, the clinicians, get their kind of perspective, and then the groups that are focused more on kind of direct provision to women, kind of like the people sharing information about women's health, the different menstrual cycle apps, like that's been really cool as well. And that's something that I don't normally get in an academic setting. I don't get to interact with those people as much, so that's been really exciting.
Addressing women's health and the 4Ms is so important because we are 50% of the population and we have been overlooked for so long. And actually, when we're supporting half of the population, we're supporting everyone, including men, and we're creating a much more fair and equal society.
It's really important to address the 4Ms, particularly as someone who does research in sexual and reproductive health. It's incredibly important to see the things that inform the menstrual experiences prior to starting your period and thereafter, and that's integrally linked to their mental well-being and psychosocial well-being. So if we're able to know what research is happening, know what informs these 4Ms, we're able to holistically address the needs of women across the globe.